Welcome back.
Hi.
How are you?
Good.
I'm going to give you some patient...
So here's the day of my surgery. I'm going to tell you, I was very, very nervous. Excited but nervous.
The second sheet is HIPAA Privacy Act, and the third allows us to bill your fees and bring them up when you're done.
The mere fact that this was about to happen was really something. Now, there were a few more forms that I had to fill out that were specific to the surgery, and then I was taken back.
Kimber?
Oh.
Are you ready?
Yeah.
Yeah? My name is Terry. I'm one of the nurses.
Okay. So I was called to the back by Terry the nurse. I recognized her when I interviewed her for the Life Beyond Bunyan show.
You're in good hands. I really did not believe him. And yet I heard patient after patient who told me it was easy.
Yes.
It was great. I'm here to have my next foot done. And that was, to me, that was finally the proof that said he must be doing something right.
Right.
It's been about 2 months, and it's truly everything he said it was.
That's great. And that's why you have a big smile on your face.
Absolutely. I can say with the utmost confidence that do not put it off another day, that it is easy, it's pain-free, and it's great. I'm so glad I did it. You all set? Okay, come on back.
Once I came out and I was ready for surgery, she began to take me over to this other room.
So if we can take your left sock off.
And in this room here, we did first my before photo.
Okay.
Remember, this is the photo where we do the before and after.
Get you tucked in.
As they tuck me into this bed and make me all cozy and comfortable. And I do have to stress comfortable because everyone has such a great personality and they really, really make me feel comfortable.
Okay, just relax your arm for me. Get your temperature.
A lot of questions were asked on a specific form, and they're so thorough that those questions are asked again by another nurse, just to make sure that, I'm giving the same answers and everything is covered.
No. Recreational drugs?
No.
Alcohol?
Yes.
Occasionally? Well, we never know. We just have to keep... And then what we do here is we write a nice, happy yes on here, and we write a nice, big no on here.
Oh, there you go.
So everyone, like a human hairdryer, it's going to keep you warm.
Ah.
Most surgical centres are cold, and
Yeah.
you've had nothing to eat or drink, and you're in a paper gown.
So I'm Dr. Edinburgh, I'm your anesthesiologist.
Hi there.
Hi.
Next, I met with the anesthesiologist, and he asked me a couple more questions, and then he takes my heart rate. He, too, makes me feel very comfortable. I'm really happy with the staff that Dr. Moy has. And I remember seeing him on Dr. Moy's website when I was doing my research.
Because he does such a good block, and it's so effective, the amount of anesthetic I give, or the sedation that I give, is quite minimal. So the patients, again, when they wake up, they're much more awake and they're less likely to have nausea or vomiting. The second thing that's quite remarkable is his surgical skill and the technique that he's developed. He's able to minimize the trauma and the inflammation that's associated with foot surgery, and that greatly reduces the swelling, the inflammation, and the pain that the patients experience post-operatively.
Can you now take a deep breath? And let it out. Okay, again, deep breath. Let it out. Okay. Very good. Do you have any questions for me? Have you been to the restroom already?
Mm-hmm.
Okay.
Yeah.
I'll be back in 2 minutes with the medicine.
Okay.
Get you a little bit sleepy and we'll get started, okay?
Yeah.
So you need to wear your shoe 24/7 until you see Dr. Moy on Friday. Is that when your appointment is? Your post-op appointment?
9 a.m. on Friday.
Friday at 9? Mm-hmm. Okay. So pretty much today you're going to go home, you're going to put your foot up on a couple pillows, and you need to just pretty much just stay off it. You're allowed to get up 5 minutes an hour, but for the most part you just need to stay off it, keep it elevated, put lots of ice. Your foot will have a dressing wrapped right around the middle here. So you can just lay a nice peck over here. You can put it up on your toes. Either way, just anywhere in this general area. 20 minutes every couple hours.
Okay.
Okay? You need to start your medication tonight. You have your prescriptions filled?
Yes.
So it's 2 medications. One of them is Toradol. You'll start tonight with dinner. It can be a little irritating to your stomach, so you always want to take it with food. Take it as directed morning and night until it's gone, which is 4.5 days worth.
Okay.
The other medication is Vicodin for pain. Most people don't need it at all. Your foot will actually be numb for the first 2 or 3 days. So if you were to need it at all, it would be down the road.
Okay.
And that's it. Okay? So let me have you sign that. I'm going to give you a copy of this so you can read through it more at length if you'd like to.
Okay.
Alrighty. Okay, we're going to get your IV started.
And then she puts a little, it's like a small straw that goes underneath the skin that gives you all your happy meds and the good stuff.
I just won't watch.
It just takes a second.
You okay?
Yeah, I'm good.
It was good.
Just don't want to think about it.
You didn't cry or anything?
So after I'm done filling out all the forms for the consent, then we have the IV that goes in. And I have to tell you, there's that needle again. They made me feel pretty comfortable. They were joking around, didn't even think about the fact that they slipped that into me.
Hi, Kimber.
Hi.
Jackie, I'll be with you in the operating room. And I know that you've just answered these questions, but I have to ask you all over again.
All right. And I also remember watching Jackie's story online while reviewing Dr. Moy's website.
Dr. Moy he has very good surgical hands. He's very steady. He's very precise. He has a good eye. He's very accurate. And above all, he's extremely consistent. And I think that's why his patients overwhelmingly have such an incredible good result. And it's because he is consistent. He's methodical. What can I say? He's overall just an excellent surgeon. Tell me what we're doing.
My left foot?
And he's doing the bunion.
Right.
And he's putting a tiny screw in your toe.
Right.
So you understand the surgery as it was explained to you by Dr. Moy?
Yes, I do.
Any questions about the surgery itself?
No.
Okay. How about at all then? Or
No.
Everything's been answered?
Yep.
Okay. We'll be taking you back in just a few minutes.
Okay.
Thank you.
Just sit my head back.
Yeah. You might feel a little bit dizzy at first.
Oh.
The burning lasts for about a minute.
Mm-hmm.
And then the next thing you know, we're all finished. Sort of that's like, oh, it's hurting. And then the next words you hear, I'm going to be telling you we're done.
Okay.
Okay. So,
Hi, Kimber.
Hi.
How you doing?
I'm like getting ready to go into a sleep.
Okay. Let me just take a look at your foot here. We're going to do your left foot and your left bunion right here, correct?
Correct.
Okay. Any last minute questions for me at all?
What?
Any last minute questions for me at all?
No.
Feeling nice and relaxed now?
Yeah.
Yeah. Okay. It'll be just a few minutes and we're going to go into the OR, okay?
Okay.
All right.
Well, no, I didn't trust my diving partners.
Oh, you didn't?
No. And so the first night I told them, I said, you're going to go in first. I like that. I am the warrior.
Good song, huh?
just a coincidence.
It is cold in here.
Yeah, I'm going to hook you up to that warmer again once we get you over here.
Have you do, Kimber, is scoot over to that bed to your right. Bring your sheet with you.
You ready? The bottom one, you mean?
No, the one on top
of this.
you. Yeah. Just scoot on your bottom. Perfect.
Okay, now I'm going to put your arm out on this cushion here. Okay, this is just oxygen.
Boy, she has a nice singing voice.
So this is just oxygen right now?
Yes,
Yeah,
it is.
just oxygen. Nothing more.
Kind of Woody Harrelson likes to intake. The really clean oxygen bar.
There you go.